Servus Männer, it's Red Pill Germany again. In Germany, at the moment, a confrontation between our health minister, or the federal government, I should say, and health workers is underway. It is escalating because of this new, let's say, pharmaceutical product that they wish to inject into the body of our healthcare workers, our health workers, yeah, like hospital workers, nurses, and so on. It turns out that a sizable number of these people don't want to get this new, brand new, actually so new that it's not even tested properly, pharmaceutical product, this concoction. So I reported to you in one of my previous videos that there is a priority list, like in many countries, also in Germany, and it goes by age, but also by occupation and maybe some illness that you have or something. So there is a priority list, and of course, health workers, hospital workers, and so on, they are in the highest priority group. So that means they are on the top of the list. They would have to be injected right now, together with the over 80-year-old people. However, as I said, and as the media also reports, many of them, they refuse. They don't want to be a beta tester. They don't want to be a guinea pig. And our health minister now says, and by the way, I have heard that already half a year ago. Authoritative voices and all these spokespeople and all these these higher bureaucrats, they were urging doctors and nurses to be open to getting injected early and being somewhat of a beta tester, and that is their duty. Now I look at this whole thing from a whole different perspective, I would say. First of all, yes, I can totally emphasize with these health workers. I wouldn't want to, I mean, I'm very glad that I'm on the very, very low priority part of the list. Probably in half a year or in 1 year, I have to answer this question. But right now, nobody wants to inject me with anything because I'm relatively young and healthy. But I can totally understand that they don't want that because, of course, there are side effects. But my perspective, as I said, is very different. And I want to present that to you now. So I'm basing this on information that comes from the German public media, the state media, the manufacturer of that pharmaceutical product, and, of the state in general. So this is undisputed stuff, right? This is not some opinion or something. This is the official truth about this thing, right? I'm not saying anything that is contrarian to the mainstream facts on this product right now. So what do they say? They say that they did a lot of tests, preliminary tests, I would say, with thousands of people, and the outcome was that your symptoms are reduced, you're not having a severe case, and blah, 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 right? But what they very clearly state is that as of now, they do not know yet whether or not you can still infect other people during that time while you're when you have been injected this stuff, right? They don't know if it makes sure that you cannot be a carrier or a multiplier. You yourself might be protected, but you can still pass it on to other people. So this is what they say. This is not my opinion or something. Once again, this is what the mainstream media, the state media, what they all say, what the manufacturer also says. If that is true, or, well, we don't know yet, but let's look at this from a logical perspective and from an ethical one also. You have people who are old, who are sick, who have a lower probability to survive this disease, or they have an increased risk of critical or severe conditions. if those tests that they carried out were made correctly and this pharmaceutical substance actually has the effect that they claim, yes, then it makes sense to inject those people who are old or frail or weak or whatever, right? But does it make sense to inject a lot of people who are just in contact with these people if you don't know yet whether or not it keeps you from passing it on? That is the big question, because I think it doesn't make sense. Because unless you would see this as the actual test, as the actual experiment, like if they want to inject the health workers and just let them go about their business as if they are safe, and then see if people are dropping like flies around them, and then they have their answer. I mean, unless it's that what they want to do, which is very ethically very, very sketchy, I would say, very not okay. Unless it's that, I don't get what they're trying to do, because not at the moment there is a very scarce supply of the substance, right? There are millions of people they want to inject, and they can only inject a couple of thousands. So that would mean that you would keep this substance from someone that it could definitely help, people over 80, right? If, and I say this once again because I see the comments already in my, in the back of my head, I can see it already. If these tests are done properly, if this stuff can actually do what they promise it does, then only in that scenario it would be helpful to those old people. And what sense does it make to use thousands and thousands of doses on health workers that are young and healthy, and that it probably doesn't help at all? Yeah? And the effect that they want to achieve is that they don't act as multipliers. We don't even know if it has this effect yet. So in that sense, you would keep thousands of doses away from old people that you could actually help in order to run a dubious experiment, an unethical experiment on these health workers to find out whether or not they can still pass it on. Yeah? That is, in my opinion, what is going on here. This is the only thing that makes sense, because otherwise this whole strategy doesn't add up on a purely logical level. So we have a substance, we know it helps group A, and we do not know if it helps group B. And by helping group B, I mean preventing them from being a multiplicator, somebody who passes on the disease while not having symptoms or severe critical symptoms himself. Okay? And we could help group A with all the doses that we have right now, with all the vials or with all the material, the substance that we have right now. But no, we want to use it on group B, but we don't even know if it helps or not. So either they are keeping some information from us, or they're just full of crap. Because this doesn't make sense. It doesn't make sense at all, or it is stupid, or it is ethically completely hideous and morally completely wrong what they're doing here. And by the way, the Catholic Church, for example, just as an example, yeah, and then this is one example how the church completely lets people down these days. I learned in school, in Catholic religious instructions in Bavaria, I said, we don't have the term the deadly sins anymore, or the Todsünden or something, right? Instead, modern theology, funny, huh? Modern theology, it uses the term in sich schlechte Handlungen. That means actions that are bad intrinsically, in and of themselves. Like there is no scenario, there are no circumstances that would make it all right. Huh? And then this is kind of like the deadly sins, right? So, or the cardinal sins, or whatever you want to call them. Okay, so one of those things that they said, the Catholic Church that is, that they said is an action that is bad in and of itself. That is medical procedures that are not necessary. Yeah? And they mean by that, for example, plastic surgery in case you are not a burn victim or something like that, right? Just if you say, oh, I want to have bigger this, I want to have smaller this, They said, the Catholic Church said, this is a bad action. It's morally absolutely unsalvageable. This is horrible, yeah? Because there are always risks involved and there is no actual benefit. And yes, you might argue, yeah, it gives you confidence, there is a psychological benefit to your quality of life, blah, blah, blah. No, the Catholic Church doesn't care about that. They said there is no, life is sacred and there is no hardcore medical effect. That means you're not, you're not dying or something, you're not having a horrible life otherwise. But this is just, yeah, capriciousness or something like that, right? This is just first world problems or something. And they said it doesn't justify the risk of having this medical procedure. And I would say taking pharmaceutical substances is probably also should with the same logic fall under that category, right? And to me, this is completely one of those cases. We don't know if it has any effect, but it definitely has risks. And so, from a Catholic theology point of view, this should be labeled as morally wrong. And what does the church do? Of course, they support the New World Order, they support the European Union, the German state, all these organizations. They don't say anything, when it's about some cosmetic incision or surgery or something like that, then they run a big mouth. But when it's about this thing, which follows the same logic, by the way, then crickets, or even worse, support for the globalists. All right, so that was my take on that. And let's see how the battle in Germany between our more than more than able and very, very proficient health minister Jens Spahn against his hospital workers turns out. Because, I have a little feeling that they don't want to fire thousands of nurses during the middle of what they call is an epic century plague event, like the pandemic of a century, right? I'm kind of doubtful that they want to fire a major part of their nursing staff. I cannot give you a percentage. I mean, I don't know how many of them are unwilling to take the shot, but it's a sizable amount. Otherwise, they wouldn't raise a fuss about it. All right, take care. Servus, Kameraden.